Hello, my beloved doctors. This video gonna be very interesting because you will know how to ace any question regarding the neck veins and its relation to cardiac diseases. In the last video, we saw this, the venous pulses waves tracing, the A for atrial contraction in the late diastolic phase, followed by C wave, very small, not seen clinically. It is related to the tricuspid valve closure and the isovolumetric contraction in the right ventricle. And this is the X descent because of the right atrium pressure drop to receive blood from the systemic circulation, and then it's followed by the V wave, which is the start of RA, right atrium, RA diastole, volume increase in the right atrium, which is followed by tricuspid valve opening and descent of the blood from the right atrium to the right ventricle, causing Y descent, followed by another A wave, and so on. Okay, let's give you the secret. The A wave will be related to any pressure overload on the right atrium in the right side. Anything that will cause right side pressure elevation will make a giant A wave. Anything, this is the key number one. The key number two, anything that will make a volume overload, not pressure overload. Pressure overload, A wave. Volume overload will make a big V wave. Okay, right. The C wave, not seen clinically. You will not be asked about this. Just name and correlation, not for pathologists. The X and Y descents is correlated with pericardial diseases. Pericardial diseases, mainly constrictive pericarditis and pericardial tamponade. Constrictive pericarditis and pericardial tamponade. Right? Okay. This is the normal waves. A wave, C wave, X, V, Y. Okay. If you have tricuspid stenosis, stenotic valves causes pressure overload because it causes pressure gradient. Stenotic valves causes pressure overload. Regurgitation causes volume overload. As you see, for example, aortic valve stenosis causes pressure overload. That's why it causes left ventricular hypertrophy. But aortic regurg causes dilated cardiomyopathy because it's volume overload. Right? So, in tricuspid valve stenosis, the right atrium will contract against the higher pressure. So, the A wave should be bigger. Okay, this is the normal A wave. See, this is the A wave if you have tricuspid valve stenosis. Okay. How about tricuspid regurgitation? Tricuspid regurg causes volume overload on the right atrium transmitted into the jugular venous pulsations waves as a big V wave. So you will have a normal A wave but big V wave. In tricuspid stenosis you have normal V wave, that the volume not affected so much. But actually, if you are a good observer, you may notice that the V wave should be should be less than usual. Should be less than usual. But the focus here is the big A wave. The big A wave. Okay. In the tricuspid regurgitation, the V wave is much bigger. Okay. How about the pericardial diseases? Tamponade, constrictive pericarditis. X and Y descent will be affected. X and Y descent will be affected. How it happens? Normally, this is X, this is Y. In pericardial tamponade, you have very steep and deep X. Steep, deep X in pericardial tamponade. But shallow Y. Shallow Y. See the difference? This is a little bit deeper. This is so shallow. Alright? How it happened? During pericardial tamponade. During pericardial tamponade. When the right ventricle is contracting, the pericardial fluid moves down around to surround the right ventricle, which causes a sudden drop in the right atrium, causing steep, deep X descent. Okay, this will not last so much because still pericardial fluid is surrounding the whole heart, but actually during RV contraction, like here, we know that the X descent is related to the systolic phase of the ventricle. Correct? See here, the X descent is related to systole of RV and LV, but we are talking here about the right side. So during systole, during the RV contraction, the pericardial fluid goes and surround more quickly, moves quickly to surround the RV because there is a space here because the RV is contracting. But so the RA pressure will drop suddenly, excessively, because it was compressed and then the pressure has been released. So the X descent will be steep. Okay, but actually then the right ventricle will expand again. When it is expanding again, it is not fully expanded because it is surrounded with a pericardial fluid, which is inhibiting its fully expansion to receive blood from the right atrium. It is not able to receive blood from the right atrium. So the Y descent, which is the right ventricle diastole, will be diminished. The problem of the pericardial tamponade is a circulation collapse because the heart is not able to fill with the blood because the intracardiac pressure is very high. The intrapericardial pressure is very high. The heart is unable to expand and receive blood. So the Y descent will be very shallow because blood cannot goes downward from the right atrium to the RV because of the high pressure inside the RV, because it is compressed from outside by the pericardial fluid. This is tamponade. Okay, this is circulatory arrest. It contracts, yes, so it has an XY descent, but the patient is shocked because it is not filled. It is not filled. That's why your patient here is shocked, but you have these waves. Okay, how about the constrictive pericarditis? Constrictive pericarditis is clinically resembling the restrictive cardiomyopathy. Restrictive cardiomyopathy. You have both a deep, steep X descent and deep Y descent. Deep Y descent. Compare between this and the normal one. This and the normal one. Your X is deep and steep more than the normal one, and here the Y normally, and this is a big Y descent here. How it happens? How it happens? In constrictive pericarditis, in constrictive pericarditis, the X descent gonna be steep and deep because the contracting right ventricle will pull the right atrium downwards. We have a fibrosis in the pericardium, so the contracting RV will pull the right atrium downward during its contraction, making it expands in size, making a drop, much bigger drop in the right atrium pressure, which is transmitted as a steep, deep X descent. Alright, why you have a deep Y? Why you have a deep Y wave? Because during constrictive pericarditis, the resting early diastolic pressure in the RV is much lower than the resting right atrium pressure, which make a pressure difference between the right atrium and right ventricle with an exaggeration of the normal, and the blood goes suddenly, rapidly from the right atrium to the right ventricle, but it will have a mid-diastolic arrest. The diastole will not continue because the constrictive pericarditis will make the right ventricle not allowed to expand fully to receive the whole amount of the blood. So the Y wave will be early, steep, and then it will arrest in the mid-diastolic phase. We call it usually mid-diastolic arrest. So let us summarize. The A wave will disappear when? In a patient with atrial fibrillation. In a patient has atrial fibrillation, because during atrial fibrillation or flutter, the atrial contraction is very thready, very weak, cannot make an A wave. That's why the only patient with ischemic myocardium or left ventricular hypertrophy but doesn't have S4 during examination is the atrial fibrillation patient, because S4 is like the A wave. They are caused by atrial kick, they are caused by atrial contraction. So in atrial fibrillation you doesn't have S4, you doesn't have A wave. A wave will be giant if the patient has tricuspid valve stenosis or pulmonary hypertension for any reason, because the pressure gradient will be high, the atrium will contract against the high pressure, so the A wave will be prominent. Another interesting thing is the cannonball A wave. Cannonball A wave. Cannonball is a very giant A wave caused by complete heart block, because in complete heart block the right atrium will be contracting against close the tricuspid valve, make the right atrium pressure very big, transmitted into the right sided neck veins as a very big giant A wave called cannonball A wave. Cannonball A wave in complete heart block, exclusively complete heart block. V wave, anything that will make the volume overloaded in the right side will have a giant V wave. Not just related to the overload in the cardiac diseases like tricuspid regurg or atrial septal defect, because in atrial septal defect the blood passes from the left atrium to the right atrium, causing right atrium pressure to be raised, so you have big V wave. It also may be big because of non-cardiac diseases like any patient with kidney function problem, renal failure, we have volume overload and V wave will be big. Liver cirrhosis with hypoalbuminemia and volume overload will have V wave abnormality as well. It will be very giant. Right? X descent steep and deep in both pericardial tamponade and constrictive pericarditis, and we know the reason. Y descent will be steep in constrictive pericarditis and planted, obliterated in the pericardial tamponade, and we have cleared the reason. I wish you have enjoyed our session today, and I'm looking forward to seeing you with the last video in neck vein examination series, and we're gonna solve a very nice quiz together. Stay tuned. We love you. Bye bye.